So irreversible anticholinesterase, as the name indicates, they will bind to a cholinesterase enzyme and they will inhibit the cholinesterase enzyme irreversibly. That means I have already explained you the structure about the cholinesterase enzyme. Okay, so it has a two sides. First side is anionic site and second side is stereotic site. Okay, so at the steric site, these compounds will bind and it will inhibit this enzyme irreversibly. That means ultimately they are increasing the acetylcholine at the neuronal junctions. Okay, so reversible inhibitor we have seen. Okay, they can dissociate that a complex, whatever complex is becoming between the compound and the enzyme, that can be hydrolyzed. Okay, so that's why they are reversible inhibitor. Now these are the irreversible inhibitor, and I have already told you irreversible inhibitor of acetylcholinesterase means organophosphorus compounds or pesticides. जितने भी पेस्टिसाइड्स होते हैं, they are the irreversible inhibitor of acetylcholinesterase. Means once they will bind at the stereotic site, they will inhibit the enzyme, and the enzyme and drug complex will not be dissociated easily. Okay, so that's why they are irreversible inhibitors. So these are the organophosphorus compound. They are absorbed practically from all routes of their administration or all routes of administration. Why? Because see, organophosphorus are, they are highly lipid soluble molecules. They are highly lipid soluble molecules. And organophosphorus compounds or pesticide कहाँ पे आता है आपका compound contact में? So if anybody is spraying a insecticide in the his field, particularly the farmers, जो किसान होते हैं, वो किसान क्या करते हैं, उनके क्रॉप के ऊपर कोई पेस्ट ना आ जाए, इसलिए वो स्प्रे करते हैं क्या, ये इंसेक्टिसाइड. और वो कुछ प्रोडक्शन वगैरह लेते नहीं, मतलब प्रोडक्शन वगैरह उनके पास कोई सूट वगैरह नहीं रहता है, वो नॉर्मली ऐसे ही स्प्रे कर देते हैं. ठीक है, खुली आंखों से या फिर उनका सिर्फ इनर वेयर्स पे ही वो स्प्रे करते हैं. तो समटाइम्स व्हाट हैपेंस कि वो स्प्रे करते करते क्या होता है कि वो स्प्रे अगर हवा उल्टी दिशा में आई तो वो स्प्रे उनके बॉडी पे आ जाता है. और बीइंग हाईली लिपिड सोल्यूबल ड्रग्स, ये जो ऑर्गेनोफॉस्फोरस कंपाउंड्स होते हैं, दे आर हाईली लिपिड सोल्यूबल एंड वो स्किन के थ्रू या स्किन के ऊपर से ही एब्सॉर्ब हो जाते हैं. ठीक है, मतलब जो हाई लिपिड सोल्यूबल ड्रग होता है वो इजीली बॉडी में एब्सॉर्ब हो जाता है. ठीक है, तो सबसे मेन बैरियर एब्सॉर्प्शन के लिए अपना कॉर्नियल लेयर होता है. लेकिन बीइंग अ हाईली लिपिड सोल्यूबल ड्रग, दिस ड्रग कैन क्रॉस द ये जो केराटिन है आपका बॉडी का, केराटिन लेयर, अपर इपिथेलियल लेयर, उससे भी क्रॉस कर जाते हैं वो, और सिस्टेमिक एडवर्स इफेक्ट दिखाते हैं, मतलब टॉक्सिसिटी. सो दीज आर इरिवर्सिबल इनहिबिटर ऑफ acetylcholinesterase enzyme. Okay, so they are classified further in the three types. Therapeutically useful organophosphorus compound means those pesticides or organophosphorus compound, they can be potentially useful for in the therapeutics. What are they? For example, they are ecothiopate, then metriphonate and dipropyl fluorophosphate. Ecothiopate, metriphonate and dipropyl fluorophosphate, DPP. So these are used therapeutically in the glaucoma. They are not usually internally use करेंगे तो मर जाएंगे. So they are used externally for treatment of glaucoma. Okay. Again, insecticides like phenathion, parathion, malathion and monocrotophos. Malathion, parathion, monocrotophos. All these are the pesticides. They are the name of pesticides. Those who are from rural background or those who are from the family of farmer, they might have aware about these names: malathion, parathion, monocrotophos. Okay, they are insecticide. Highly toxic nerve gases. Third class is highly toxic nerve gas. For example, tabun, sarin, and soman. So these last two, sarin and soman, they are mostly synthesized for chemical warfare. So you might have seen the story of Hitler. So he was very cruel king, right? Not a king. वो जो भी था, हिटलर जो भी था, वो क्या करता था, जू जो लोग होते हैं, जो लोग होते हैं, तो उनको क्या करता है, वो उनको बहुत बेदर्दी से, मतलब उनके प्रति उसका मतलब ये बहुत ही बेकार था. एक्चुअली वो क्या था कि जो हिटलर वो शासक था जर्मनी का शासक था हिटलर. और उसको पूरे वर्ल्ड में ये करना था। लेकिन उसी टाइम पे क्या है, जो ब्रिटेन होता है, ब्रिटेन ब्रिटेन का जो वहाँ पे जो शासक थे, उन्होंने क्या किया, तो वहाँ के कुछ लोग, मतलब वहाँ के जो रेसेस है ब्रिटेन में, जो जू लोग है, वो जू लोग यहाँ जर्मनी में भी थे। और जब हिटलर हिटलर इनिशियल स्टेज पे था, वो एक कमांडर था इसमें, आर्मी में, ठीक है, वो एक बार मतलब ये छुप गया, वो वहां पे हाइड हो गया एक घर में, ठीक है, जर्मनी में ही हिटलर हाइड हो गया एक घर में, एक हाउस में। और वो हाउस एक जू का था, ठीक है, और जू का था और वहां पे हाइड हो गया। वो जू ने क्या किया, वो इन्फॉर्म कर दिया अथॉरिटीज को कि ये यहाँ पे हाइड हो चुका है। उसकी वजह से उसके बाद में मतलब उसके दिमाग में एक सनक बैठ गई कि कुछ भी हो जू लोगों को खत्म करना है, ठीक है। तो वो क्या करता था, जू लोगों को पकड़ता था और एक कमरे में बंद करता था, वहां पे नर्व गैस छोड़ता था और उनको तड़प तड़प के मरने तड़प तड़प के मरते समय वो देख के वो बहुत खुश होता था हिटलर। सो दैट नर्व गैसेस, तो ये जो नर्व गैस है सैरिन एंड सोमान, दीज नर्व गैस आर यूज्ड फॉर केमिकल वॉरफेयर। आजकल नहीं यूज होते लेकिन पहले होते थे। व्हाट आर द थेरापेटिक यूजेस ऑफ दिस इरिवर्सिबल एंटीकोलिनेस्टरेज? What are the therapeutic uses of these pesticides? So they have very limited use in the clinical, but they can be used topically for treatment of glaucoma. For example, as I have told you, these three. Okay, so ecothiopate, they are used as a local. They are applied locally in the form of eye drop for the treatment of glaucoma. Certain insecticides are used for the treatment of worm infection. Okay, for example, dichlorowas, trichlorophos are the anthelmintic, means they can remove worms from your intestine, but they are not clinically used because these are the highly poisonous drugs. So only clinical use of these irreversible inhibitor of acetylcholinesterase is a glaucoma. Remember, ecothiopate, ये एक बार क्वेश्चन आया था, सो ये याद रखो। देन नाउ व्हाट हैपेंस समटाइम्स, बिकॉज ऑफ दिस, these are the very highly lipid soluble molecules, and a farmer may accidentally get poisoned with these insecticides. So organophosphorus poisoning is one of the favorite topic of examiner, so they can ask question on this. So you have to be clear about this organophosphorus poisoning. Okay, so organophosphorus poisoning, so poisoning, see, I have told you many times, poisoning can occur by three reasons. First one is occupational. You are farmer and you are spraying insecticide, and accidentally you got that because of your occupation. That is nothing but the occupational. That is nothing but the occupational. Second one is the accidental. Okay, accidental. Accidental means by accident. You don't know about the insecticide, but by accidentally you got consumed the insecticide. So that is accidental. And third one is a suicidal. Third one is a suicidal, means if you want to do intentionally suicide by consuming the insecticide or the drug, that is a suicidal. And there is one more known as a homicidal. Okay, अगर आपको किसी को मारना है, मतलब if you want to kill anybody, then you are involved in the giving the poison to another person, that is nothing but the homicidal. So occupational, for example, जैसे फार्मर्स लोग होते हैं, जैसे स्प्रे करते हैं वो इंसेक्टिसाइड, पर उसमें मैंने जैसे बोला था, कभी कभी स्प्रे करते करते जो विंड है वो डायरेक्शन बदल लेता है, और जो भी आप स्प्रे करते हो वो आपके शरीर पे आ जाता है, और उस टाइम पे बीइंग दीज आर द वेरी लिपिड सॉल्युबल ड्रग, और वो एब्सॉर्ब हो जाते हैं आपके बॉडी में और फिर आपको पॉइजनिंग करते हैं। तो पॉइजनिंग में भी आइदर बिकॉज ऑफ these three reason and one more reason known as a homicidal. What are the symptoms of this irreversible anticholinesterase? So you know that we have seen in the morning lecture. So anticholinesterase means what? They are doing one thing. They are increasing the acetylcholine level at the neurons. Okay, means whatever the actions of whatever actions of acetylcholine are there. So they are nothing but the these kind of action will be the symptoms and signs of poisoning of irreversible anticholinesterase. जो भी एसिटिलकोलिन का एक्शंस है उसी टाइप के एक्शंस मिलेंगे। जैसे अगर ओवरडोज हो गया आपका एसिटिलकोलिन का, या फिर ओवरडोज हो गया आपका ये इसका किस्सा ऑर्गेनोफॉस्फोरस का, तो क्या होगा आपको? सबसे मेन चीज आपका डायरिया हो जाएगा। डायरिया हो जाएगा आपका, क्योंकि जेआईटी में मूवमेंट बढ़ जाएगा आपका। डायरिया, वोमिटिंग, आपका जो पिपिल साइज है वो बारीक मतलब कम हो जाएगा। सो पिन पॉइंट भी हो जाएगा, या फिर मियोसिस हो जाएगा. ओके, मियोसिस, डायरिया, वोमिटिंग, spasm of accommodation, bronchial secretion will be increased, so bronchospasm will be there. Then again, sense of tightness in chest, nausea, vomiting, anorexia, abdominal cramp because of increased peristalsis. These will be the muscarinic effect. Okay, so you know that acetylcholine act by two type of receptor, muscarinic as well as nicotinic. Okay, so muscarinic effect will be like this: meiosis, spasm of accommodation, then bronchospasm, increase in the bronchial secretion, sense of tightness in the chest, then nausea, vomiting, anorexia, abdominal pain. Then what will be the nicotinic effect of poisoning of this organophosphorus? These are including fasciculation. Fasciculation means unwanted contraction of your muscles. Fasciculation, twitching, generalized weakness, and depolarizing type of paralysis. So after continuous input of your acetylcholine, that will continuous depolarization will leads to weakness and later on paralysis of muscle, that particular muscle. Then either they can produce tachycardia or bradycardia. These will be the nicotinic effect of poisoning of organophosphorus. Now central effect, centrally anxiety, confusion, then your ataxia, hypertension, respiratory depression, convulsion and death, and coma and death. Okay, so these are the central effect. Then neurotoxic effect, so DFP, then MyPox produces demyelination of nerves. जो आपका माइलिन कवरिंग होता है, माइलिन शीट होता है आपके न्यूरॉन्स के ऊपर, so that will be lost. So there will be demyelination of neurons because of these pesticides. Okay, unfortunately there is no treatment. Once there is a demyelination, there is no treatment available to treat that. Okay, there is no treatment available for neurotoxic effect of these pesticides. Sometimes what happens, adulteration of olive oil जो होता है, जो edible oil है, olive oil, sometimes adulteration of that olive oil by one lubricating oil known as a triorthocrysyl phosphate that caused thousands of death in the tragedy in the North Africa. कि जो olive oil होता है उसमें क्या करते थे, उन्होंने क्या किया, अडल्ट्रेशन किया उसमें, किसमें, olive oil में, किसका, लुब्रिकेटिंग ऑयल का, उसका नाम है ट्राइऑर्थोक्रिसिल फॉस्फेट. तो दैट इज ऑर्गेनोफॉस्फोरस कंपाउंड, ट्राइऑर्थोक्रिसिल फॉस्फेट इज यूज्ड लुब्रिकेटिंग इन वेरियस पर्पसेस, but adulteration of this with the olive oil caused thousands of death in the North Africa. This is known as North African tragedy, just for your knowledge. इसके ऊपर क्वेश्चन नहीं आएगा आपको, लेकिन मोस्ट इंपोर्टेंट थिंग इज दैट ट्रीटमेंट ऑफ ऑर्गेनोफॉस्फोरस पॉइजनिंग. Okay, this is important. They can ask question on this. So it is recommended by WHO, World Health Organization. Now first, once you got organophosphorus poisoning, अगर poison आपने पिया है, मतलब poison आपने ingest किया है by mouth, तो first thing आप एक काम करो, वो poison जो पेट में गया है आपको, उसको absorb मत होने दो. तो कैसे नहीं होने दे सकते आप absorb, जो अंदर गया है उसको बाहर निकलो. Okay, so rapid gastric lavage, so rapid cleaning of your stomach, rapid gastric lavage, then clear the secretion from mouth, pharynx by suction. तो suction pump डालेंगे आपके मुंह में और वो जो भी अंदर है वो सब खींच लेंगे बाहर. ठीक है, तो endotracheal, nasopharyngeal intubation, then mouth to mouth respiration should be avoided here. Okay, so normally what happens, फर्स्ट एड में सिखाया जाता है अपने को कि माउथ टू माउथ रेस्पिरेशन देना है, बट इसने पेस्टिसाइड पिया है, पेस्टिसाइड इंजेस्ट किया है, सो यू कैन नॉट गिव माउथ टू माउथ रेस्पिरेशन टू हिम, कि पता चला कि उसको बचने के चक्कर में आप ही मर गए. ठीक है, क्योंकि उसने पॉइजन लिया है और पॉइजन है पेस्टिसाइड है, और वो पेस्टिसाइड आपने माउथ टू माउथ रेस्पिरेशन देने के चक्कर में आपके बॉडी में भी गया, तो आपको भी टॉक्सिसिटी हो जाए. ओके, so mouth to mouth respiration in this case should be avoided. Then IV fluids we have to introduce, and supportive care and nursing care. Okay, then you have to use specific antidotes and all that. Now what is a specific antidote for organophosphorus poisoning? That is known as a pralidoxime, PAM. This is very important. So very specific antidote for organophosphorus poisoning is nothing but the pralidoxime, that is a PAM, or it is also known as a 2-PAM. So it is nothing but a compound which is a cholinesterase activator. Now what organophosphorus क्या करेगा, cholinesterase inhibitor है और irreversible inhibitor है, as compared to acetylcholine. Now you have to reactivate that. So for reactivation purpose, this pralidoxime is used. So it is a specific antidote for organophosphorus poisoning. That is a pralidoxime. So it is a cholinesterase activator, and along with that, atropine can be used. But atropine cannot be used in the patient with cyanosis. ठीक है, जिनको एयरवे का प्रॉब्लम है तो उनको यूज नहीं कर सकते अपन atropine. Specific antidote is a pralidoxime, but supportive is atropine can be used as supportive. Now, atropine is the antidote of choice in both organophosphate and carbamate poisoning. Okay, remember organophosphate or antidote in case of carbamate poisoning and organophosphorus poisoning. Drug of choice is atropine, but atropine cannot be used with patient with cyanosis. Specific antidote is a pralidoxime. Remember, oximes and cholinesterase reactivators. Oximes are the cholinesterase reactivator. So pralidoxime. Okay. So pralidoxime is, it is a compound. It is a derivative of oxime. Oxime, it is a derivative of oxime. Pralidoxime is one of the compound from oxime derivative. Okay. So oximes are the cholinesterase activators. Okay. The irreversible inhibition produced by irreversible inhibition of cholinesterase produced by organophosphorus compound, which is due to the phosphorylation of groups at the esteratic site. जो मैंने बोला था esteric site and anionic site. So the irreversible inhibition is because of the phosphorylation at esteric site. Okay, and that is not easily hydrolyzed. That's why it is an irreversible inhibition. Now you have to reactivate it. Okay, the enzyme should be reactivated so that metabolism will be there. Okay, metabolism of acetylcholine. See, whatever actions you are getting is because of the increased acetylcholine level in the body, because they are the inhibitor of organophosphorus are the inhibitor of your acetylcholinesterase. So that enzyme is inhibited, and that's why it is not able to metabolize the available acetylcholine, and that's why you are getting the effect, that is muscle spasm in the cramps in the GIT, diarrhea, vomiting. Okay, those are nothing but the actions of acetylcholine. So in this case, the pyridine to aldoxamine chloride, this pyridine to aldoxamine chloride, or it is known as a 2-PAM or pralidoxime, pyridine to aldoxamine chloride, same is these both the name are same, एक ही कंपाउंड के नाम है. ठीक है, pyridine to aldoxamine और pralidoxime, शॉर्ट में बोलते हैं उसको pralidoxime. Okay, 2-PAM. And another compound is the diacetyl monoxamine, DAM. So DAM is more potent than PAM. ठीक है, diacetyl monoxamine is a more potent compound than pralidoxime. But remember, pralidoxime is a specific antidote. अगर उन्होंने पूछा which one of following is a specific antidote for organophosphorus poisoning, आपको pralidoxime तो याद रहता है 2-PAM, बट कभी कभी कंफ्यूज करने के लिए वो आपको ऑप्शन देते नहीं pralidoxime का, वो आपको देंगे diacetyl monoxamine. So diacetyl monoxamine भी it is also cholinesterase activator. Okay, so जहाँ पे pralidoxime ऑप्शन में नहीं है तो वहाँ पे अगर diacetyl monoxamine है तो वो आंसर है आपका. ठीक है, so it is more potent than pralidoxime. These are the specific antidote for your cholinesterase specific cholinesterase reactivator, or specific antidote for organophosphorus poisoning, pralidoxime and this DAM, 2-PAM and DAM. Parasympatholytics. Okay, whatever we have seen, these are nothing but the parasympathomimetics drugs, indirect and direct acting parasympathomimetics. We have completed that. Now parasympatholytics. What do you mean by parasympatholytics? These are the drugs which can block the actions produced by parasympathetic nervous system or actions produced by acetylcholine. So whatever actions are there of pharmacological actions of acetylcholine, if any drug is able to block those actions, that is known as a parasympatholytic. Okay, I have explained you these terms in very first lecture. What is sympathomimetic? What is sympatholytic? What is parasympathomimetic? What is parasympatholytic? If any drug is able to produce the action produced by noradrenaline, that is known as sympathomimetics. Okay, what is sympatholytic? Blocking of actions produced by noradrenaline, that is sympatholytic. What is parasympathomimetic? If any drug is able to produce the action which is normally produced by acetylcholine, that is known as parasympathomimetic. What is parasympatholytic? So parasympatholytic means if any drug is able to block the actions of acetylcholine, that is known as a parasympatholytics. Okay. Now these are the drugs which are used as a parasympatholytic. Classification of parasympatholytics. So mostly these are the propane alkaloids and their derivative. Propane alkaloids and their derivative. Okay. Mostly they are the not they roughly called as a parasympatholytic, but actually they are muscarinic blocker, not nicotinic blocker. Broadly, parasympatholytic means any drug which can block muscarinic as well as nicotinic receptor. But आइडिया ऐसा नॉर्मली होता है ना, बट वो ऐसा होता नहीं है यहाँ पे. ठीक है, मतलब टर्म जो है पैरासिम्पेथोलाइटिक, ये टर्म के हिसाब से जाएंगे अपन पैरासिम्पेथोलाइटिक, तो उसके हिसाब से दोनों को ब्लॉक करना चाहिए, मस्करनिक प्लस निकोटिनिक. बट जो पैरासिम्पेथोलाइटिक ड्रग डिस्कस करते हैं अपन, those are mostly a muscarinic blocker. So natural alkaloids like atropine, scopolamine. Okay, so it is available. It is they occurs in the Atropa belladonna, then Datura metal. These plants, alkaloids, propane alkaloids. They are biosynthesized from ornithine amino acid. Remember, ये ornithine वाला question आया था एक बार. Semi-synthetic derivative like semi-synthetic derivative of this atropine, homotropine, then atropine mononitrate, ipratropine bromide. This ipratropine bromide is used in the bronchial asthma in the inhalation. Tiotropium bromide, then synthetic derivative of this. Okay, so mydriatics example cyclopentolate, topicamide. These two are the used as a mydriatics to increase the pupil size. Then anti-secretory. Anti-secretory means this will prevent the secretion. So natural alkaloids, semi-synthetic and synthetic. In the synthetic, you have different subtypes. Okay. So first one is a mydriatic, that is cyclopentolate and tropicamide. All these are the derivative of atropine. Remember. Okay. Then second class is anti-secretory. उसमें भी different classes है. Anti-secretory. Okay. उसमें anti-secretory and anti-spasmodic second class है. Anti-secretory, anti-spasmodic. Okay. उसमें दो क्लास है सब टाइप, क्वाटरनरी कंपाउंड एंड टर्शियरी अमाइंस. ओके, क्वाटरनरी अमाइंस और टर्शियरी अमाइंस. तो क्वाटरनरी कंपाउंड और क्वाटरनरी अमाइंस कौन है? प्रोपेंथैलिन, देन ऑक्सीफोनियम, ग्लाइकोपाइरोलेट, पाइपेंजोलेट एंड मिथाइल ब्रोमाइड. पाइपेंजोलेट, मिथाइल ब्रोमाइड. ओके, सो प्रोपेंथैलिन, ऑक्सीफोनियम, glycopyrrolate, pipenzoate, methyl bromide. So all these are the quaternary. Okay, and they are mostly used as an anti-secretory agent. These are mostly used as an anti-secretory agent. Okay, so they are used to prevent the secretion of gastric acid. जो अल्सर्स होते हैं, गैस्ट्रिक अल्सर्स, उसमें यूज करते हैं प्रोपेंथैलिन, ऑक्सोफोनियम. ओके, देन glycopyrrolate is mostly used in the pre-anesthetic medication. Then tertiary amines, for example, dicyclomine, then velethamate and pyrazepine. Okay, so out of this, dicyclomine is an antispasmodic. Okay, these are mostly used as antispasmodic. Then vasoselective, for example, oxybutynin, fluvoxate and toluridine. There are few drugs which are used as anti-Parkinson, like trihexylphenidil, then procyclidine and bipyridine. We have seen these drugs in the when we was discussing anti-Parkinson drug. Okay, so this is the classification. Now again you can see the classification: cholinergic, anticholinergic drugs. Okay, so whenever there is term of anticholinergic, they are mostly a anti-muscarinic. Anticholinergic drugs are mostly anti-muscarinic drugs. And जो drug neuromuscular junction को या जो drugs nicotinic receptor को block करते हैं, उनको mostly they are known as a neuromuscular blockers. Okay, so there is another separate chapter over there. So anticholinergic drugs. So these are nothing but the anti-muscarinic, like atropine and scopolamine. Okay, then anti-nicotinic. ठीक है, ये anti-muscarinic जो बोला है, anti-nicotinic कौन है? So nicotinic neuronal anti-NN, they are known as a ganglionic blockers. Then anti-NM, neuromuscular blocker. Okay, so neuromuscular blockers कौन से? They are different type. So competitive or non-depolarizing, non-competitive or depolarizing. So non-competitive depolarizing में आता है succinylcholine, then decamethonium, succinylcholine, decamethonium. They are non-competitive depolarizing. ये classification बहुत important है, ये आया था question में. So which one is a non-depolarizing neuromuscular blocker? Which is a depolarizing neuromuscular blocker? So तो नॉन डीपोलराइजिंग में आपको सिर्फ याद रखना है कि दो ही एग्जांपल है, सक्सिनिल कोलिन एंड डेकामेथोनियम. ओके, नॉन डीपोलराइजिंग, नॉन कॉम्पिटिटिव और डीपोलराइजिंग ब्लॉकर्स, न्यूरोमस्कुलर ब्लॉकर्स. डीपोलराइजिंग कौन है? सक्सिनिल कोलिन एंड डेकामेथोनियम. अभी कॉम्पिटिटिव और नॉन डीपोलराइजिंग neuromuscular blockers, they are again divided into three types depending on the duration of action. So long acting, intermediate acting and short acting. So long acting is D-tuberculin and pancuronium, D-tuberculin and pancuronium. Then intermediate is vacronium and atracurium. Okay, so all these are, curium means they are curare alkaloids. Okay, curare alkaloids. Then short acting is a mevicurium and repacuronium. So long acting is D-tuberculin and pancuronium. Then intermediate acting is a vacronium and atracurium. Then short acting is a mevicurium and repacuronium. इतना याद रखो. सी अभी देखो पेनकोरियम एंड सॉरी, इसको याद रखने का एक सिंपल फॉर्मूला है कि डी ट्यूबरक्यूरारेन मतलब क्या? ये ट्यूबरक्यूरारे मतलब क्यूरारे अल्कोलाइड है. अभी इनिशियली इसको आइसोलेट किया था, दैट इज अ लॉन्ग एक्टिंग. अभी ये एट्राक्यूरियम जो है वो और विक्रोनियम जो है वो सिंथेटिक मॉलिक्यूल है, सेमी सिंथेटिक. सो दे आर हैविंग इंटरमीडिएट एक्शन. एंड देन अगेन शॉर्ट एक्टिंग जो यहाँ पे नहीं है वो शॉर्ट एक्टिंग है. तो दीज आर द एंटी कोलिनर्जिक ड्रग्स. So mostly anticholinergic drug means actually they should able to block both the receptors, nicotinic and antimuscarinic. Collective term anticholinergic means collectively they are known as a antinicotinic or antimuscarinic both. But most of the time anticholinergic drugs means only antimuscarinic drugs. They are known as a skeletal muscle relaxant. ये जो है ना बाकी से ये एंटीनिकोटिनिक ड्रग्स जो है उनको बोलते हैं skeletal muscle relaxants. So antinicotinic drugs are known as skeletal muscle relaxants. So we will see this in the, and antimuscarinic okay means anticholinergic mostly. थोड़ा confusion होगा यहाँ पे कि ideally anticholinergic means दोनों antimuscarinic plus nicotinic, but most of them जो pharmacologically जो भी बुक्स है सब जो भी दिया है उन्होंने antimuscarinic मतलब भी anticholinergic दिया है और वैसा होता भी है मोस्टली. और ये जो एंटी निकोटिनिक है उसको स्केलेटल मसल रिलैक्सेंट बोलते हैं. सो दीज आर नथिंग बट द स्केलेटल मसल रिलैक्सेंट. मस्कर्निक ब्लॉकिंग एजेंट. ओके, सो मस्कर्निक रिसेप्टर ब्लॉकिंग एजेंट इंक्लूड्स एट्रोपिन एंड रिलेटेड अल्कलॉइड्स फ्रॉम एट्रोपा बेलेरोना, दतुरा, हायोसाइमस, देन स्कोपोलामाइन. एट्रोपिन इज अ प्रोटोटाइप ऑफ दिस क्लास. मतलब बाकी जो ड्रग है वो डिस्कस नहीं किया जाएगी, एट्रोपिन डिस्कस किया जाएगा. उसके एडिशन में अगर कुछ होगा तो वो बोला जाएगा. ठीक है. सो टू इंपोर्टेंट अल्कलॉइड्स फ्रॉम बेलेरोना, दैट इज एट्रोपिन एंड स्कोपोलामाइन. सो आउट ऑफ दिस एट्रोपिन इज अ डी एंड एल हायोसाइमिन. ओके, सो इट इज अ रैसमिक मिक्सचर ऑफ एल हायोसाइमिन. एट्रोपिन इज अ रैसमिक मिक्सचर ऑफ एल हायोसाइमिन. देन स्कोपोलामाइन इज देयर. स्कोपोलामाइन इज नोन एज हायोसिन. ओके, that we have seen in the pharmacology. Then atropine and its synthetic analog are mostly commonly used as an anticholinergic. Atropine and its semi-synthetic analog, they are used as an anticholinergic. Okay. So now what is the mechanism of action? Atropine and related drugs, atropine and other drugs, competitively block the muscarinic receptor. They will competitively block muscarinic acetylcholine receptor. The blockage can be reversed by increasing the amount of ACH. That means they are competitive. They are a competitive blockage. There is a competition between acetylcholine and atropine for the receptor. Okay, so that's why there is a competitive block, not non-competitive. It is competitively blocking the muscarinic and acetylcholine receptor. These drugs do not interfere with the release of ACH from the cholinergic nerves. They will not interfere with the synthesis of ACH or synthesis of acetylcholine or release of acetylcholine, but they are doing competition with acetylcholine for the receptors. Salivary and bronchial secretion are extremely sensitive, while smooth muscle, GIT, eyes and heart are less affected. Means because muscarinic receptor are mostly present in the this area. मतलब जो ग्लैंड्स होते हैं उसमें मस्करिक रिसेप्टर होते हैं और वैसे मस्करिक रिसेप्टर आपका हार्ट में भी होता है, बट द सलाइवरी ग्लैंड्स आर मोस्ट सेंसिटिव टू द एट्रोपिन. means atropine can block the excessive secretion of glands, right? And that's why atropine is a valuable drug in the case of various poisoning, in case of various secretions. Atropine is not able to block the effect of vagal stimulation. मीन्स अगर आर्टिफिशियल वेगल स्टिमुलेशन अगर करेंगे आप तो उसमें एट्रोपिन काम नहीं आएगा. नाउ फार्माकोलॉजिकल एक्शंस ऑफ एट्रोपिन एंड स्कोपोलामाइन, ओके, बोथ. नाउ आउट ऑफ दिस एट्रोपिन इज अ CNS stimulant and scopolamine is a CNS depressant. So atropine is a CNS stimulant and scopolamine is a CNS depressant. And because scopolamine is a CNS depressant, it is used as an anti-emetic or it is used in the motion sickness. Scopolamine will depress the CNS and that's why it is used in the motion sickness or antiemetic. This atropine is a CNS stimulant. Okay, so both these drugs will reduce the all the secretions. जो भी secretions होंगे आपके, so secretion will be reduced. All the secretion like exocrine gland except production of milk. मतलब जितने भी exocrine gland है इसमें, जैसे आप lacrimation will be reduced, salivation will be reduced, bronchial secretion will be reduced, gastric secretion will be reduced, okay, pancreatic secretion will be reduced, bile secretion will be reduced, each and every secretion will be reduced, okay, sebum, okay, sweat, everything will be reduced. So secretion will be reduced. Decrease in the salivary secretion will result in the dry mouth, and that's why dryness of mouth is a adverse effect with the atropine therapy. Okay, so atropine will decrease the saliva and will cause dryness of mouth. Difficulty in swallowing, आपको निगलने में तकलीफ होगी. Gastric secretion are decreased. Volume and total acidity will be reduced. Okay, acidity कम करेगा आपकी और volume भी कम करेगा उसको. Then reduction in the secretion of mouth, nose, pharynx and bronchi. Okay, so जो भी bronchial secretion होगा वो thick होगा. So viscid secretion, inhibition of sweat gland secretion and has very less effect on pancreatic and intestinal secretion. There also it inhibits, but it has a less effect, but still it inhibits. So secretions will be inhibited by atropine. Now what is the effect on smooth muscle? So obviously, so acetylcholine क्या करेगा? It will increase the tone of smooth muscle. It will increase the contraction of smooth muscle in the GIT and it will cause increase in the peristalsis. But atropine is a muscarinic blocker. The actions will be opposite to that. Okay. So what will be the action on GIT? So reduction in tone and motility of GIT. Reduction in tone and motility of GIT. Excess antispasmodic activity will be there. Means relaxation of your intestinal smooth muscle. Again, what is the action on biliary tract? जो बाइल का डक्ट है आपका, बाइल डक्ट और बिलियरी ट्रैक्ट बोलते हैं उसको, जो बाइल डक्ट है उसके ऊपर क्या होगा? सो इट हैज एंटी स्पाज्मोडिक इफेक्ट ऑन गॉल ब्लैडर एंड बाइल डक्ट. ओके, अगेन यूरिनरी ट्रैक्ट भी सेम, reduces the urethral peristalsis and cause urinary retention. समझ में आ रहा है नहीं आ रहा है? आर यू गेटिंग और नॉट? यहाँ पे देखो एसिटिलकोलिन क्या करता है आपके जीआईडी में, वहां पे वो सिक्रीशन बढ़ाएगा, वहां पे पेरिस्टालसिस बढ़ाएगा, वहां का मसल का टोन बढ़ाएगा, मसल का कॉन्ट्रैक्शन करेगा, रिथमिक कॉन्ट्रैक्शन ऑफ मसल. सो पेरिस्टालसिस विल बी इंक्रीज्ड. ओके, बट as it is a muscarinic blocker and that's why it will reduce the tonicity and motility of GIT. Then excess it will cause excess antispasmodic effect, means it will dilate your smooth muscle of your GIT. So biliary tract पे same, biliary tract will be dilated. Then again urinary tract will be it will reduce the urethral peristalsis and cause urinary retention. Then what is the action of atropine on eyes? Eyes पे क्या action होगा? So mydriasis and cycloplasia. So it will increase the pupil size. It will increase the pupil size. Mydriasis and cycloplasia. Cycloplasia means the vision will be fixed for far object. ठीक है, मतलब दूर के ऑब्जेक्ट जो है उसके लिए विजन आपका फिक्स होगा और वो जल्दी मायोसिस होगा नहीं, तो उसको बोलते हैं साइक्लोपेजिया. स्पाज्म ऑफ अकोमोडेशन क्या होता है? मायोसिस जो होता है, मायोसिस मतलब जब पिपल का साइज कम होता है तो आपका जो है फोकल लेंथ कम हो जाता है और यू विल बी एबल टू सी द ऑब्जेक्ट विच आर नियरर टू यू, ओके, नॉट फार टू यू. एंड एट दैट टाइम सडनली इन फ्रंट ऑफ यू अगर आपको ब्राइट लाइट आ गया तो आपका पिपल बड़ा होना चाहिए, लेकिन होता नहीं. दैट इज नोन एज स्पाज्म ऑफ अकोमोडेशन. And this atropine will cause mydriasis and cyclopegia. because it will block the cholinergic nerve to the smooth muscle. Okay, it will block the cholinergic nerve. Okay, that's why whatever muscle of sphincter of iris will be there, so that will not be contracted. Okay, that will remain in the relaxed form due to blockage of that muscarinic receptor. So that's why it will cause mydriasis. Block leads to paralysis of ciliary smooth muscle, and this produces tightening of suspensory ligament and resulting into flattening of lens with consequent increase in the focal length. So the vision is fixed for far vision. No one can see the object clearly which are at a far distance, but cannot see the object which are at a near distance. That is known as a cycloplegia. Because of paralysis of pupil sphincter, one cannot constrict the pupil in response to bright light. This is known as a paralysis of accommodation or cycloplegia. ने बोला था. Now CVS cardiovascular system के ऊपर क्या इफेक्ट हुआ एट्रोपिन का. Now initially atropine will cause bradycardia due to stimulation of medullary vagal nuclei. Later it will produce tachycardia because of blockage of E1 receptor present in the SNO. So mostly it will cause tachycardia. It has a biphasic response. But you just remember tachycardia. So tachycardia is because of blockage of muscarinic receptor. अभी नॉर्मली एट्रोपिन क्या करता है, ब्रैडीकार्डिया करता है ना. तो इसको ब्लॉक करेंगे तो क्या होगा, टैकीकार्डिया. सो दैट्स व्हाई एट्रोपिन विल क्या कॉज टैकीकार्डिया. Atropine completely counters the peripheral vasodilation and hypotension produced by cholinergic drugs. Now what happens, जो एसिटिल कोलिन है या फिर कोलिनर्जिक ड्रग्स है जो डायरेक्ट एक्टिंग है इनडायरेक्ट एक्टिंग, सो दोज विल प्रोड्यूस पेरिफेरल vasodilation, okay, and hypotension. Now atropine can counteract this. If atropine is given, so they will not able to produce this peripheral vasodilation, and okay, so that is why atropine is a muscarinic blocker. Now CNS के ऊपर क्या, atropine is a medullary stimulant. As I have told you, it is CNS stimulant. It will cause stimulation of medullary and vagal nuclei higher centers. So increase in the rate of depth of respiration. So atropine will stimulate the respiratory center and cause increase in the depth of respiration. Atropine in moderate dose cannot control the tremors and rigidity of Parkinson patient. It stimulates the vagal, respiratory and vasomotor center, but depresses the vestibular excitation and has anti-motion sickness activity. So because of depression of vestibular excitation, it has a anti-emetic activity, but its anti-emetic activity is not clinically much useful because you have better option, scopolamine. In contrast to atropine, scopolamine depresses. Remember, scopolamine depresses the reticular activating system and usually produces the euphoria, drowsiness, amnesia, dreamless sleep, and production of REM. Atropine causes rise in the body temperature because of inhibition of sweat gland, as well as by stimulation of temperature regulating center. So atropine will increase the body temperature by inhibiting the sweat gland. अभी टेम्परेचर रेगुलेशन कैसे होता है, देखो, अगर आपके बॉडी का टेम्परेचर बढ़ गया तो आपका स्वेट ग्लैंड एक्टिवेट हो जाता है और स्वेटिंग होता है आपको, और स्वेटिंग होने के बाद जो स्वेट निकला है बाहर वो इवापोरेट होता है, और इवापोरेट होने के बाद आपको कूलिंग सेंसेशन होता है, आपको कूल होते हैं. ओके, दैट्स हाउ body temperature is decreased if it is increased, and again it is also decreased by central mechanism known as a temperature regulating center located in the medulla oblongata. It has a mild anesthetic action on the cornea. Now absorption, distribution, metabolism and elimination. So it is well absorbed from GIT, detoxified, that is metabolized by liver. Scopolamine is mostly metabolized as compared to atropine. Scopolamine is mostly metabolized as compared to atropine. Presence of atropine esterase enzyme in some rabbits can detoxify atropine rapidly. कुछ rabbits होते हैं, कुछ races of rabbits होते हैं, उन्हें एक atropine esterase enzyme होता है, तो उनमें क्या होता है, atropine का इफेक्ट ज्यादा रहता नहीं, मतलब rapidly metabolism होने की वजह से. That is known as racial tolerance. ठीक है ना. racial tolerance जो है इनिशियली फर्स्ट फ्यू लेक्चर्स थे अपने फार्माकोलॉजी को, उसमें बोला है हमने आपको रेशियल टॉलरेंस क्या होता है, क्रॉस टॉलरेंस क्या होता है, स्पेसिस टॉलरेंस क्या होता है. एग्जांपल भी दिया था इसका. एट्रोपिन कैन क्रॉस प्लेसेंटर बैरियर. एडवर्स रिएक्शन क्या होंगे इसकी. एडवर्स रिएक्शन, मेन एडवर्स रिएक्शन ऑफ ड्राइनेस ऑफ माउथ, डिफिकल्टी इन swallowing, tachycardia, fever, constipation, blurred vision, retention of urine, It can precipitate glaucoma in elderly patient. Okay, it can cause allergic reaction locally like dermatitis, conjunctivitis, and swelling of eyelids. These are mostly because of the pharmacological actions. Dryness of mouth. वो मस्कनिक ब्लॉक कर रहे हैं वो सब सिक्रेशन कम कर देगा. ड्राइनेस तो हो गए ना. So it is due to pharmacological actions. Now acute atropine poisoning. Scopolamine is more toxic than atropine. Remember, toxicity can cause due to accidental ingestion of the thoracids or symptoms of atropine poisoning includes following. So effect due to muscarinic block होने की वजह से क्या इफेक्ट मिलेगी वही सेम ड्राइनेस ऑफ माउथ डिफिकल्टी इन swallowing intense thirst tachycardia palpitation flushing hyperpyrexia due to inhibition of sweating and same dilation of mydriasis blood vision photophobia urinary urgency difficulty in the micturition retention of urine why symptom. Now central effect as it is central stimulant excitement restlessness motor incoordination slurring of speech disturbances of memory confusion hallucination occasionally mania and delirium nausea vomiting as it is central stimulant that's why nausea vomiting hypertension are infrequent severe poisoning result in the depression of vasomotor center respiratory paralysis which is the most frequently with scopolamine. Now drug category like tricyclic antidepressant phenothiazine antipsychotics and antihistaminic also possesses some anti-muscarinic activity. So these kind of drug like antidepressant then antipsychotics phenothiazines antihistaminic drug इनको भी थोड़ा सा एंटी मस्करनिक एक्टिविटी होता है ठीक है तो दैट्स व्हाई they can aggravate the symptoms of atropine poisoning means they can increase the symptom of atropine poisoning. Now what are the treatment for atropine poisoning? So you have to use universal antidote if it is ingested by mouth universal antidote to reduce the absorption of alkaloids and the symptoms of this atropine poisoning can be reversed by physostigmine specific antidote physostigmine remember यहाँ पे क्वेश्चन बन सकता है. Now, synthetic and semi-synthetic atropine substitute chemically they are quaternary ammonium compound like quaternary ammonium compound and tertiary compound. Now quaternary compound they are less absorbed orally and do not cross the blood-brain barrier. Okay, and they will non-selectively block the muscarinic as well as nicotinic receptor. And then tertiary amines can absorb orally and can cross blood-brain barrier and they are selective to nicotinic receptor. Okay, so synthetic semi-synthetic atropine analog ये याद रखो quaternary and tertiary. Quaternary जो है वो orally absorb नहीं होगा और blood brain barrier को भी cross नहीं करेगा and they are non selective muscarinic and nicotinic. and जो tertiary होता है वो tertiary orally भी active है और blood brain barrier को cross करेगा और वो nicotinic receptor के specific होता है. They are classified as semi-synthetic derivative of atropine are classified as those which are used as a mydriatic and cyclophagic to increase the pupil size. Okay, those are atropine, homotropine, ecatropine and cyclopentolate, then tropicamide. These drugs are used as a mydriatic and cyclophagic. Second is antispasmodic. So antispasmodic like atropine, then metoscopolamine, then methamphetamine, propanthelin. Then those which are used in the Parkinson disease they are triaxyl phenydyl, then procyclidine and bipyridine. Those which are used in the bronchitis and bronchial asthma like ipratropium bromide. यहाँ पे एंटीस्पाज्मोडिक में एक एग्जांपल है डाइसाइक्लोमाइन एंटीस्पाज्मोडिक में एक एग्जांपल है डाइसाइक्लोमाइन and propanthelin is mostly used as an anti-secretory agent. Atropine mononitrate, so it is also used as a mydriatic used to treat the congenital hypertrophic pyloric stenosis. अभी ये जो टर्म है आपको समझ में आएगा मैं बोलता हूँ congenital hypertrophic pyloric stenosis मतलब क्या मतलब इसका मतलब ये है कि आपका जो इसोफेगस है और आपका जो स्टमक है उसमें उसके बीच में पाइलोरिक एंड होता है स्टमक का वहां पे उसका जो पाइलोरिक स्फिंक्टर होता है अगर आपको बाय बर्थ ही उसका स्टेनोसिस मतलब वो ब्लॉक है तो आप जब भी खाना खाओगे वो नीचे जाएगा ही नहीं पेट में. सो दैट इज नोन एज अ कंजेनाइटल हाइपरट्रोपिक पाइलोरिक स्टेनोसिस. सो इट इज यूज्ड टू ट्रीट दैट कंडीशन. नाउ मिथोस्कोपोलामाइन It is a devoid of central effect of scopolamine and it is used in treatment of renal colic, frequency of maturation associated with cystitis. Renal colic means spasm of ureter. Okay, that is a renal colic. Frequency of maturation. अगर आपको बहुत ज़्यादा वाइडिंग में जाते हो, आप बहुत ज़्यादा वाइडिंग का सेंस होता है आपको ड्यू टू इन्फेक्शन, in that case methylscopolamine is used. Then methantheline, so it is a high ratio of ganglionic blocking to the muscarinic blocking activity. Okay, it is mostly used as a ganglionic blocker, methantheline. बाकी इसमें कुछ इम्पोर्टेंट नहीं. नेक्स्ट इज propanthalline. So it is related with the methantheline, but it possesses more potent ganglionic blocking and muscarinic blocking action. So mostly it is used as a ganglionic blocker. It is used as a muscle relaxant in irritable bowel syndrome (IBS) and relieving the pain of diverticulitis in the treatment of diarrhea. Okay, it is a popular cholinergic drug for peptic ulcer. So it is also used as an anti-secretory agent and also antispasmodic agent. Remember, it is used to treat the spasm associated with irritable bowel syndrome. Then it is used in the treatment relieving the pain of diverticulitis. ये क्या है मुझे भी नहीं मालूम. ठीक है. Then treatment of diarrhea. Then it is popular for its anti-secretory agent. It's popular for its anti-secretory property in the peptic ulcer and gastritis. Okay. Then oxyphonium. Oxyphonium is a potent antispasmodic. Again, antispasmodic है और ganglion blocking agent भी है. But it is mostly antispasmodic. Oxyphonium. Then pyranzapine. It is a tricyclic compound, selectively muscarinic blocker. Okay. And it is also used to prevent the secretion of gastric acid in the stomach. So it is useful in the treatment of peptic ulcer. It is used to control the hyperacidity and duodenal ulcer. Peptic ulcer, duodenal ulcer. So pyranzapine, propanthalline, these are the mostly used as an anti-secretory agent in the gastric and duodenal ulcers. This dicyclomine is a tertiary amine and it has a direct smooth muscle relaxing property. So this drug is used in the treatment of dysmenorrhea and it is antispasmodic. Intestinal spasm. अगर आपके पेट में दर्द हो रहा है, आपके पेट में मुरड़ा आ रहा है, तो डाइसाइक्लोमिन का एक टैबलेट मिलता है, उसका नाम है साइक्लोपाम. टैबलेट का ब्रांड नेम है साइक्लोपाम, मैन्युफैक्चर्ड बाय इंडोको फार्मास्यूटिकल्स. वो यूज करते हैं. डिस्मेनोरिया वही जो आपके जो लेडीज में जो ये होता है, डिस्मेनोरिया मतलब आपका जो मेंस्ट्रुअल साइकिल होता है उसमें अगर इरेगुलरिटी है उसमें अगर आपको तकलीफ हो रही है तो उसमें उसको बोलते हैं डिस्मेनोरिया. एबनॉर्मल सिक्रेशन ऑफ योर सिक्रेशन, vaginal secretion, that is known as a dysmenorrhea. So it is used in that condition. It is mostly used as antispasmodic. Remember. Now there is another drug known as a flavoxate. Okay. It is again a tertiary amine and it is a local anesthetic, analgesic and slight anticholinergic property. It is having local anesthetic, then analgesic, then anticholinergic property. It also has a direct relaxation on tension of ball of smooth muscle. It is used to treat anuria, then neural lenuresis, and supraphobic man and urinary urgency. जिनको ज़्यादा यूरिनरी अर्जेंसी है तो उसके ट्रीटमेंट के लिए यूज किया जाता है. सो दैट एंड फ्रीक्वेंसी एसोसिएटेड विद सिस्टिसिस, जिसको सिस्टाइसिस हुआ है मतलब जिसको यूरिनरी यूटीआई या सिस्टाइसिस हुआ है तो उनको ज़्यादा फ्रीक्वेंसी होता है किसका, यूरिनेशन का. मतलब यूरिन तो नहीं होता उनके ब्लैडर में, लेकिन उनको सेंस होता है कि यूरिन के लिए जाना है. because of that infection, and in that condition flavoxate is used. Then oxybutynin, it has an antimuscarinic, direct antispasmodic and local anesthetic used to fix the urinary bladder. Again same, it is used in the treatment of urinary urgency, urge of incontinence, urinary frequency, and also used in the spina bifida and neonatal nocturnal enuresis. जिसको स्पाइना बाइफिडा प्रॉब्लम होता है ना, तो उसको उसमें भी कंट्रोल जो है यूरिन का वो नहीं रहता, तो उस टाइम पे यूज करते हो। और जो बेड बेड में इशू करता है उसको भी यूज करते हो, जो बेड में इशू करता है ना, मोस्टली चिल्ड्रंस, ठीक है, नॉक्टरल एन्यूरेसिस। देन लास्ट इज द टोलटेरोडिन एंड फेसोटेरोडिन। टोलटेरोडिन एंड फेसोटेरोडिन, फेसोटेरोडिन is a prodrug of tolterodine. They are tertiary amine, acts as a specific muscarinic M3 blocker. Then they are used to treat the bladder detrusor instability. Again, why is same problem? The treatment of urinary incontinence, and also used to convert the, it is converted into active metabolite with the same agent. Tolterodine. Tolterodine is converted into active metabolite fesoterodine, or fesoterodine is a product of tolterodine. Then drug therapy of overactive bladder syndrome. Then solifenacin and darifenacin. These are the two new drugs, solifenacin and darifenacin. They are claimed to be literally bladder specific in the antimuscarinic action. These are also antimuscarinic drugs, but they are more specific in the bladder, and they are used in the treatment of overactive bladder syndrome. ये क्वेश्चन आया था एक बार, सोलिफेनासिन एंड डेरिफेनासिन, दे आर यूज्ड इन द ओवरएक्टिव ब्लैडर। ओवरएक्टिव ब्लैडर मतलब वही ना कि अगर आपको ब्लैडर में यूरिन नहीं है फिर भी आपको लग रहा है कि नहीं यार यूरिन जाना है, यूरिनल जाना है, वाइडिंग करना है, दैट इज नोन एज ओवरएक्टिव ब्लैडर। फ्रीक्वेंसी ऑफ यूरिनेशन कितना है? नॉर्मली अपन यूरिन के लिए कितना बार जाते हैं दिन में? 4 या 5 बार। अगर आपको 10, 12 बार जाना, 15 बार जाना पड़ रहा है तो मतलब यू हैव ओवरएक्टिव ब्लैडर. These drugs are used to treat the overactive bladder syndrome. Solifenacin and darifenacin. So out of these, solifenacin is the longest acting and oxybutynin is a short acting from this class. मतलब ये क्लास में solifenacin is the longest acting and ये जो oxybutynin है वो shortest acting है. Then new mirabegron is a newer drug approved for overactive bladder, acts by stimulating the beta 3 receptor. ये mirabegron अपन ने देखा था, mirabegron. Already we have seen this mirabegron in the yesterday's lecture. So again it is also approved by overactive bladder.